Pena. I'm owner and founder of NP2Go. I'm a nurse practitioner. This is our first podcast that we are hosting and plan to host once or twice a week. I have my guest, Jennifer Parrot, on here. She was my clinical supervisor during my clinical rounds while I was in nurse practitioner school.
My name is Jennifer Parrot. I am a nurse practitioner. I've been one for 15 years. This is my 20th year in nursing altogether. I went into nursing. Actually, I'm probably about 19 collegiate hours from having my bachelor's in mass communications from OU. Wow. But when I had my son, I had such an excellent experience in the hospital that I literally changed my major overnight and became a nurse. So I've been in the ER my entire career. That's where I met this young lady. Lots of trauma, and that's it.
So one of the reasons I brought you in here today and wanted to start this podcast is I really wanted to highlight mental health care in healthcare workers, first responders, firefighters, police, especially after COVID. But even before COVID, I'm not sure that the hospitals or any institutions truly treated mental health in healthcare workers. And I think that COVID got to highlight that. But one of the ways we wanted to highlight mental health in healthcare workers would be to be able to share our experiences in an anonymous way. So we'll allow viewers to either write in anonymous submissions of any story that they want to share, any traumatic thing that they want to share to just get off their heart, or they want it to be read out loud. They could also send a voice clip of them reading their story. If we air voice clips, we could anonymize the voice clip as well, so nobody would ever know it was you that said it. Obviously, we won't share any PHI or violate HIPAA, but a part of healing trauma is knowing that you're in a safe space to share it with other people that understand you or that have been through what you've been through. One of the things I think is so hard for lay people to understand is that when you work in the hospital or you work as a first responder, you're doing all these things out in the field, and then your shift ends and you go home and you're a mom and you're a wife and you're a daughter and you're all these other things, but you really didn't deal with all of the things that you went through that shift that normal people day to day don't have to deal with, see, touch, feel. So that's the main thing why we wanted to start the podcast and have this be a safe space where people can share their stories and we can talk about that. We're going to have some other segments that are also funny, so we'll bring some humor and
maybe share some good stories too.
Yes, good stories.
Right? Always up to hear the good patient stories too.
Yes, for sure. Can you tell me about the pandemic and how that has affected mental health of healthcare workers or how that has shifted?
I think you nailed it earlier. It brought light to the world on mental health for healthcare workers. That was one of the most trying times we will go through. And it's going to be interesting to look back in 20 years on what we did learn from it. Safety of the nurses was a big thing. A lot of places didn't have what they needed, but the nurses still went in day after day and risked themselves.
Yes.
We definitely saw a shift in patients and their knowledge towards healthcare, but their treatment towards the staff. It was a trying time. A lot of people were emotionally down because they couldn't see their loved ones when they were dying.
So they were missing that human family connection.
The patients and the patient's family, I feel like, were very hostile at times, but I understand. They were emotionally just not even able to compute what's going on. Like, my mom's in there dying and I can't be with her. So both sides, it was stressful.
What support do you wish that you had during that time that you didn't have?
Looking back, more staff.
More PPE.
More everything. More staff, more PPE.
What about debriefing after shifts?
Like having a group debriefing and going through stories. I just want to get the hell out of there.
Yeah.
I'm sorry, but after that shift, I just want to get out of there.
What advice would you give to a new nurse, maybe a new graduate nurse that's coming into nursing that might not deal with the pandemic, but is coming into this profession now?
My daughter's actually going to college next year to become a nurse. I'm fearful and excited at the same time. I love that she's following my footsteps, but she's actually going to do more of the aesthetic side of it. So we've had talks about this. Burnout's real. I feel like it's a lot more common since the pandemic. I've seen new nurses be a nurse for a year and they're done. They can't do it anymore. And that's sad. It's really sad. And a lot of the older nurses like ourselves are leaving and wanting to get out because of the stress and how everything's changed. The way that they treat us, the way that they see us. Not all for the bad. There's definitely some people that are understanding how stressed we are at work.
Any advice?
Absolutely. Just be aware of burnout. And that's exactly it. You want to make sure that you're managing your stress. Don't let it become too much. Self-care is huge as a nurse.
What do you do for self-care?
My husband and I like to ride bikes and we work out. We go hiking a lot. We got an RV last year. And now that I'm only working about 5 shifts a month, we've been in a lot of traveling.
Yeah.
We went to Hawaii and Branson in 1 month.
That's awesome.
Yeah. So yeah, definitely, that money you're making as a new nurse, take some vacations, get a massage every once in a while, talk to somebody.
Yeah.
That's the big thing is talk to somebody.
Maybe not pick up the phone when they call you to come in too.
Yeah.
And if they need someone to come in.
Absolutely. It's so easy to pick up those extra shifts as
Yes.
a new nurse. You're like, yeah,
You
you're
call me
excited.
call girl.
Yes.
Mhm.
And you can't do
I
it.
love the call money.
Yeah, absolutely. It will get you every time,
Yeah.
but you can't. Even today,
Yeah.
someone was like, hey, you want to work for me tomorrow? And I'm like, I just picked up today. No, I can't do it.
Boundaries, having healthy boundaries.
Yes.
That's what it's called. We're still working on that.
And somebody will text me, do you want to pick up my shift? And my husband's, no, you just stopped working so
Yeah.
much. Quit picking up shifts. Let's hang out. I just feel people feel like they're more entitled these days.
How do we... Patients are more entitled. Is that because of their distress too?
Probably, but I think the internet has a lot to do with it too. They Google things.
Yes.
And then they have an answer that they believe in. And then you get there
And then
and you're
anything
like,
can be created too. You can create something that looks like something else that they're like, oh, this is what I saw. This was the truth. But there's AI out there and also things that feed into whatever they believe in. Do you think that there's distrust with the medical community or a lack of respect for nurses in general or hospital workers?
I think it's a combination of both. I think there's a lack of respect.
Mistrust of healthcare workers?
Yeah, so it's both.
Or
Definitely.
mistrust of medicine or healthcare?
Yes, absolutely. I do feel like patients don't trust healthcare workers as much as they did 20 years ago. I feel like people were so respectful of your opinion and your knowledge that you went to school for
Yes.
something that they know nothing about, and they're grateful for it. Literally 20 years later, I can see that they don't trust us anymore. I don't know if Dr. Google told them that they had meningitis, and I'm telling them, no, it's just poison ivy. They don't believe you. Go home with your cough for 5 days. You don't need antibiotics. Give it 5 more days. They don't trust you. And then they get mad. And now we have the internet where they can write reviews about you. And so doesn't know what she's doing, needs to go back to school because she didn't give me my antibiotics. So they just have more entitlement to whatever they want.
Yeah.
And I hate to say that, but
Yeah.
I do
Sometimes it's easier just to give the antibiotic. It really is. It's easier. Hey, I don't want to give you the antibiotic because not only you don't need an antibiotic, but 90% of your serotonin is made in your gut. And God knows you need all that serotonin.
Yeah.
But it's just easier to give you an antibiotic because I don't want to deal with a review. And our hospitals are reimbursed by patient session
scores. Nobody wants the bad review. It's just as bad with pain meds. Never been cussed out so bad or threatened so many times by a patient because I would not prescribe pain medicine that I did not professionally think was warranted, mainly for their safety.
Yeah.
Honestly, that's really the only reason not to prescribe pain medications. It's for the safety of the patient. So you're doing what you took an oath to do, which is take care of them. Everybody be Googling stuff.
Do you think that the hospital or wherever else that healthcare workers work, do you think that they are taking steps to facilitate improvement of the mental health of healthcare workers?
I think it's coming to light. I don't know that there's many action plans that I've heard of or seen, but I think it is coming to light. I hope that helps. There's more and more nurses being threatened or hurt. I tell my husband, honey, there's another nurse that's been assaulted. There's another doctor that's been shot.
It's scary.
It's very scary.
What do you think can be done to help build the respect for medicine, first responders, police, and the public?
I don't know. The problem is I don't think it's going to get any better. I see it only getting worse. And again, that's why I'm stepping aside after 20 years.
Yeah.
It's just a work-life balance. It needs to be changed.
Yeah.
There has to be change. I think nurses need to feel safe and patients need to trust us. I don't know where that misconnect is. I hate to say administration, but the population, I feel, just bring it back to trusting us. We are here for you.
It maybe comes down to insurance companies and how much they dictate in the hospital. Insurance companies practicing medicine, and they're the PBMs, and they're this and they're that. I would love an insurance revolution.
Absolutely.
We hate insurance. They've done so many wrong things to people, denied medical care.
Just completely cut them off in the middle of treatment. Like, how do you do that to somebody?
I think that could be a place that we start. I also think having the medical shows or a show like this will help bridge the connection between the public and first responders and healthcare workers.
I think it's an excellent idea because we know what we go through. They don't know what we go through. And I think we could probably learn a lot from the patient as well. I want to hear patients, what they think, or why they think that way about us. Tell me why. What did I do to make you not trust me?
Have you heard of short rounds?
So you know what? It's an excellent idea. It's needed. I think a debriefing needs to be needed. But again, after the end of a shift, it's like you just want to go home. So
maybe it's not the end of the shift either. Maybe it's like a once a week thing where they have a topic. I don't know a lot about it.
Because you know what nurses do now? They go home and drink wine.
Yeah, they do.
Seriously, like we need a way to debrief other than I seriously don't know many nurses that aren't on 1 or 2 psych meds.
Yeah.
Like true story. I don't
mine.
Yeah. I literally don't know a single nurse that's not on a psych med of some sort for anxiety or depression. I'm not talking schizophrenia and bipolar. I'm talking about mental health. They're all mental health. But like emotional, I'm like this because my environment's like this.
That could be a segment. How many mental health meds are you?
Seriously. And the longer I got, the more
You're right. I'm trying to think about nurses that I don't know that. Yeah.
And I feel sorry for my husband because you come home from the shift. He's so excited. I'm finally there. He waits up for me. I get up at 10 or 11 o'clock at night, and I'm like, ugh. I can't do it yet. I'm done.
Let's talk a little bit about the pandemic. So I think sometimes we forget about how crazy it was, but somebody will bring something up, and I'm like, whoa.
Do you remember all the concoctions that people made for their masks and stuff?
We had some N95s and we were doing in-home care, but I remember my first what I thought was a COVID patient. They were like 79%, and I'm like, you're going in, we're calling IMSA. Ended up being RSV, but I remember coming home, taking off my clothes and putting them in the garbage right there. Because was that scary?
I remember.
And I thought I had been exposed.
I remember people saying it's just a flu. Maybe now. But the initial strand was not. I have never in 17 years of nursing been scared to go to work and catch the flu, that I might die, ever.
We knew nurses that died.
I know several nurses that died.
My real dad actually died from COVID too.
Right.
Dad was on the ventilator. My husband got sick. I met up with somebody at an on-cue to buy an oxygen concentrator. I needed oxygen.
It was real.
Oh, yeah. Long COVID, all sorts of issues.
And I really am excited to see the research in about a couple decades to see what actually is long COVID. How many vaccinations did you get?
I think I got 2.
That's what I did. I had to get the initial to work, and then you had to get the second one, and then after that, they didn't care.
God, you even hate to bring that up because people might cancel you about that. But we did like in-home vaccines, so patients that were homebound, we did a contract and helped them get vaccinated.
That's excellent.
I didn't get it bad the first time, but losing my smell for 2 years and then gain my smell back. But
whoa, it was such a weird time. Do you remember the first nasal swab, like where they did a brain sample?
We were doing that too.
So horrible.
I would have people drive through.
Say, hey, put your car in brake because I'm about to touch your brain. Thank God there's a headrest. I hurt for 2 days afterwards. Now I tell my patients, I just need a little booger. I don't need brain. They're like, okay.
I need a little booger.
Actually, I could probably just take this little snot right there that you have. That'll work just fine. The tests have gotten so much better. You asked earlier about what has changed since COVID, and I think that patients are so much more fearful now. If they have a cough, they come in and they're like, I have had pneumonia before, or my mom died of COVID. And so they're just so fearful of it. And I'm like, it's a lot better than it was.
I've had worse anxiety after COVID, being in the hospital. Like, what are you putting in my IV? And I'm a nurse, but I want you to push it really slow. Like, crazy stuff. When we got COVID, though, I wasn't too worried because everybody around me was doing pretty well. It was really hit and miss on who was getting bad because it was that first year, 2021, I think. My mom got it from work. She's a nurse, gave it to me. We gave it to the whole family. My mom and I were getting out of quarantine and about to go back to work. And then our spouses had started a decline. So it was just wild. That was over Thanksgiving and Christmas.
Now, when you tell people they come in and they've got a sniffle or whatever, you have flu, COVID, RSV, and you're like, oh, you got COVID. And they're like, okay, cool. But in 2021, that was not the story. It was detrimental to get that diagnosis almost. The few cases I've tested in the last 6 months have been very mild, very mild.
Tell me why I was Googling last night to see if I had the bird flu.
You need a mask?
It said a little chest cold, but I was like, what is the bird flu?
See? Dr. Google.
Maybe it's a fear of going into the hospital and that whole time where you weren't allowed to have anybody. God bless them. They did what they could, but we were able to read the chart, which I know is sometimes bad for clinicians. But I was like, hey, he hasn't pooped in 17 days. And they're like, oh, okay. It was fight or flight. I know that they were taking care of the most emergent things.
It was like the ABCs at that point. We were working on people's airways and breathing at this moment. Can I ask you a question?
Yeah.
So as a family member and not a healthcare worker during COVID, how was that not being able to be with your loved one as much as you wanted to?
The particular hospital, I won't name them, but they were great. We were able to camera in. I don't know if everybody got to do it. I hope everybody did get to do it.
Physically, you weren't there, but you were able to.
Yeah, and that's why I was like, oh, his
that.
stomach's a little distended, and his chart says he hasn't pooped in a long time. Can we check into that?
Yeah.
But yeah, we were able to, when you camera in, you can look at all. I'm healthcare, so I could look at the tubes and everything.
You were able to at least talk to them. Because pictures of people looking through the windows.
Yes. You couldn't talk to him because he was intubated, sedated, but we could camera in. We could only call once a day. You had to make sure that you were also relaying that information to his other family.
I can see them being overwhelmed with that. Were they able to call you guys and update y'all daily or anything? There was just too much going on.
I feel like maybe one time a day, or we were able to call once a day and get a pretty good update. But there was a time where he didn't code, but he went to AFib and had to be converted. And we called that night, and it's someone I used to work with up there. And they're like, yeah, they converted him. And I was like, whoa, no, I didn't know that happened.
That's a lot.
But there was things like that happen that you wouldn't get a call on.
As a healthcare worker during that time.
I have a lot of sympathy for them.
Yeah.
I have a lot of sympathy because you also have anger too. Hey, I know that he isn't getting 100% here.
But you understand what's going on.
I know that you guys are just fighting for your lives.
Yeah. Of course, the rest of the world knew that.
It was hard. So crazy. Sometimes people bring up COVID and I'm like, it's like a fever dream. And then you think about the things that happen then and you're like, it's crazy. What's some of the craziest stuff that you guys did during COVID?
I was working small town USA on a contract. There were patients that were so scared to even come inside in the ER. They were so scared to come inside because of COVID that we were bringing the monitors out to their cars and doing their vital signs in their cars. True story. I was assessing patients in their cars. One man in particular was in horrible CHF failure, oozing from his legs and just on his oxygen. And I could just, it was tripod. I'm like, sir, please come into my ER. You need help. I need to admit you. He would not. He was so scared of COVID. But yeah, I will never forget assessing patients in their cars.
I love that you modified to help their needs, no matter what it was.
We did what we had to do. It was a first time for all of us. So.
I know we were busier during that time because we had also been doing mobile urgent care, IVs, that sort of thing. So yes, there was a lot of people who needed to go to the ER, and we came over and were like, you need to go to the ER. And they're like, I'm so afraid. I'm like, you have to go in.
I think it was a blessing that your startup time, because we needed more people like you who could go to homes, give fluids, check vital signs, and give vaccinations and assess patients and send them to the ER when they didn't know they needed to go to the ER.
Yeah.
That was excellent timing. Blessing for the city from you guys. Yeah, absolutely.
Also that time, telemedicine, we were also doing telemedicine too. And I feel like COVID positioned it to a way where it was like, oh, wow, we could really, there's a lot of benefits from telemedicine. There's a lot of things that you can get from visually assessing, using the tools that they have at home. They can have a pulse ox, cuff, thermometer. You can do a lot of things at home now.
That's another thing that's changed since COVID.
Yes.
It's a lot more telehealth.
COVID, flu testing, UTI, we just are widely strep tests.
When you do the stuff, do they self-dip?
Yeah,
or-
they self-dip.
Okay.
So most of them will just get a test from CVS. It has 2 strips on there, and they'll send us a picture or show it to us.
Cool.
Sometimes
Good.
it's easier just to do the
I know.
antibiotic. But
I know. Well, that's
anyways.
the thing, going back to them telling us what's best for them. And I know a lot of patients do know their body and they do know what's best for them.
yeah.
But let me use my medical knowledge, my experience to help
And
you.
it's not like
treat
we're
you.
withholding antibiotics because we want to withhold antibiotics.
I don't have stock in
no.
Keflex.
The good thing about our model and traditional medicine, this is why somebody might want a script right then, is, hey, I paid my deductible. I paid my copay. I want my script now. With how we work, if you want a script, text me. We'll talk about it the next few days, see how you do, and then I'll call something in. We're set up like because we are cash pay. So I can see where people are like, I paid for this visit. I want it right now. Unless you can give it to me in 3 days and I can find a resourceful way to get a hold of your office and get that in. So that's where I think we have a lot of advantages being cash pay and offering that to patients.
And the ability to text with them and communicate with them like that, which is so useful.
Yeah.
Because I've worked in an urgent care before, and you said that, and it brought up a story. I literally had a lady yell and scream at me because I didn't give her an antibiotic for a 2-day cough because it's viral.
Yeah.
And yelled throughout the clinic, I paid my copay, give me my prescription. Your copay does not have anything to do with your needs as a patient.
Yeah.
I'm sorry. I understand your expectations coming in. Let me give you some knowledge of why you don't need it. There were a few times that I had patients that actually said, thank you for sitting down and explaining this to me instead of throwing an antibiotic and steroids at me. I thank you. Very few, but I've had them. And it's those few that you break through to that you're like, making.
And also teaching them why they might not need this or what other things they could be doing or what to watch out for.
Absolutely. Your infection.
So I feel bad for that lady, but I also know that I pay a lot in my insurance premium every month. And then you come in and you pay your copay and you're like, oh, I'll get this because I paid. There's a gap there. And it goes back to the insurance companies delegating everything. Let's revolt the insurance.
Something needs to happen. The whole thing needs to just change.
I had this idea that we just all stop paying our premiums, but there's a lot of barriers to doing that. You can't even stop the insurance unless it's during a certain part of the year. I threw this in my head. I was like, how could we do it? Would we go to prison? Oh, yeah. Not that kind of revolution.
So I don't know if I'd known you before I had my elbow surgery. So it was when insurance first started going up. At one point, I was paying, I want to say like $300 a month for me and my 2 kids. And then a couple years later, I think it was during Obama, it was like $600 a month for me and my kids. And then a few years later, it was like $900 a month for me and my kids. And then finally, I capped at $1,300 a month. For me and my 2 kids. Healthy people here. Probably before I was on psych meds. So I didn't even have any prescriptions or anything. But so I had to have my surgery. Mind you, I was paying $1,300 a month. I went to where I worked, and the poor registration girl walks in who comes to collect your copay, and it was $900. And she goes, girl, I'm not even going to ask you for this right now.
Yeah.
So $900 for copay, $1,300 a month, and I still had to pay $8,500 out of pocket for my surgery. Registration, I'd been talking to them. They said if you are cash pay, meaning you don't have insurance, they knock off 87% of the bill. And my surgery would have only been like $5,300. $5,300 is all I would have had to pay. Not the $1,300 a month, not the $900 copay if you're cash pay, if you don't have insurance.
I did cash pay for a while.
I was like, hey, can I cash pay? And they're like, no, we've already ran it through your insurance.
Yeah. There's a lot of benefits of cash pay. I think it just scares people when you start to think about the catastrophic things. But there are ways for catastrophic things to be covered. When you start to think about cancer or other things, it is scary. COVID was free for us because we were cash pay. COVID was not free for my stepdad. And it was close to $1 million.
Are you serious?
Yeah.
No one's ever going to be able to pay that back.
Yeah. She ended up having to pay because it was out of network too, where the LTAC was and everything. If he didn't have insurance, he would have paid nothing. COVID paid for Jason's hospital bills. And then when my dad died, COVID paid for my dad's funeral too.
Did it really?
Yeah. So you had to pay for it, and then FEMA reimburses you. That was a good thing about
One less
that,
burden.
for sure. Such an interesting time. I think he threw a clot. Like, he fell at home. I think his kidneys failed. He called me, wanted me to prescribe him it. He thought his blood pressure went high, and he wanted me to prescribe him medicine. I was like, dude, your blood pressure, you need to go in. Plus, I'm pregnant. I'm not coming over to your house. They took him in, and he had COVID and kidney failure. They fixed him with fluids. Then he went to LTAC. We didn't know at first.
But then we found out these people were dying of ARDS and stuff because we were giving them
too much fluid.
And so there was a fine line between treating hydration and your kidneys.
One of the mechanisms of them, they stopped eating, they stopped drinking. That also protected them from overloading. Maybe. That's just one of my weird theories.
No, absolutely. And then they needed their fluids. They wanted their fluids too. And you're like, I literally don't want to drown you.
Yeah, but at first,
we didn't know
that.
Then
talking to people in the hospital, they weren't giving these patients fluids and doing high dose steroids and then diuretium.
And then we found out that steroids weren't good unless you're intubated, and it's just learning all kinds of different things as we go. That's what medicine is. That's the fun part about it, is that it's constantly changing. Absolutely. Yeah. We were such heroes during COVID. What happened? Right? We were heroes. There were yard signs for crying out loud. You couldn't deny that. And you felt the love. Honestly, I don't think without that love, the nurses would have been able to show up to their next shift. It was horrible. There were families that were completely separating and sleeping in different rooms because their wives were working at the hospital. My ex-husband did not let me see my kids, but I agreed with him. While I was working in the hospital and I'm exposed to 30 patients a day.
You're going to come back home?
Yeah.
What are you going to do?
Yeah.
Do I get a hotel room? I don't know.
And there were people doing that. Yes. There were people who were getting hotel rooms to stay separated. And I remember sending patients home because there were no beds. Patients that otherwise would be like a soft admit that you would probably admit because they were uncomfortable or they needed pain meds, but there was no room. So you were sending these people home going, I know in 12 hours they're going to be back. I know in 24 hours they're going to be back and they're going to be worse and they're going to need to be admitted emergently. But what could you do? We couldn't just sit there and babysit every single COVID positive patients because there was no room.
Yeah.
So you've sent extremely sick people home.
Jason was like that. And he went to the ER. It was a couple of days later and he got up and he was like 79%.
It happened so fast.
I'm calling 911. He's like, no,
it happened so fast. You would see him 12 hours later, the very next day. I'm sorry, I knew you were going to come back. Yeah. I'm glad you did. I'm glad you did come back.
He's like, I'm safer home with you. And I'm like, no, you aren't. Yeah. No, you aren't. Maybe he was. I don't know. Still have the oxygen concentrator, though. I don't know if it's black market or what. He plugged it in outside. I don't know where he got it.
I love it.
But
I saw some wows on Facebook Marketplace the other day.
Did you?
Yeah. They didn't have the computers on them, but there's definitely wows.
We might.
Do you need some?
Yeah,
they were like $25 and they look like they were in great shape.
Thank you for joining our podcast. Make sure to like and subscribe and send any inquiries or story ideas to podcast@thenp2go.com.